the pain was keeping me awake.
Sweating through my sheets at night, sore throat, cough.
I think I'm gonna die. The fever didn't go away. I was taking ibuprofen, paracetamols, antihistamines, every single medication I could find, and nothing helped. At this point, I started to call 111 to get help from emergency services. And every single time when I called them, I was told that this is not an emergency and call us when you get worse. But the worse than 39.6 is basically me passing out. I remember clearly that I cried on the phone to her saying that I think I'm gonna die because I can't eat, I can't drink, I can't even swallow my own spit. I am just very tired, just lying down and nothing is happening. Thanks to her, she let the Royal London Hospital know and she literally convinced them to take me in. Yes, there is a really limited data that people living with HIV having monkeypox, in the percentages, it's a little bit higher. But there is no study right now actually proves that there is a relation in between. And yet, I told you, my HIV is very well controlled and I never had any issues. Even my CD4 cells, the fighter cells, are so high, for some cases higher than HIV negative people. And yet I had it very severe. So I really would like to know why that virus chose me to become so severe, or what in my body caused that. Actually, unfortunately, until all the researches are done in the near future, I think we won't be able to know that.
I had first heard about monkeypox back in May because I work in the field and I had been keeping up with the news and things like that from Europe. And I was a little bit worried that it would eventually affect us here in the United States, especially being a member of the LGBTQ+ community. But I wasn't too worried about it, especially because the reported cases were really low. So it was still really rare in the United States. I kept testing negative for COVID, and so I brought it up to my doctor that I was concerned that it could be the early stages of monkeypox. And he told me to just kind of wait and see because there are a lot of things that can cause flu-like symptoms. But after about 3 or 4 days of being feverish and things like that, I ended up developing the spots. So they'd started on my arms and my hands, and over the course of a day, they spread all over my body. So I had about 30 lesions develop at that point. I had some lesions that were internal, not just on my skin, but also on my mucous membranes all over my body, basically. And those were the ones that were super painful. So before I started the medication and before I was able to get pain medication from my doctors, the pain was so severe for me that I basically was taking warm baths 6 or 7 times a day, just because that was the only thing that would make me feel better. It interrupted my sleep, which was really unfortunate. I was trying to rest up because I was sick, but the pain was keeping me awake. I was able to get seen and treated very quickly. I know that that is not the reality for most people in New York, which is really unfortunate, because just because I have access because of my work doesn't mean that I should have an easier time getting treated for this disease that's so terrible and that causes a lot of pain for people. I just feel very frustrated by the response of the government to this outbreak, and I feel like a lot of suffering could have been prevented by having earlier access to vaccines and things like that. In the national stockpile, we have vaccines. We have millions of doses of the TPOXX treatment available, and months into this outbreak, we're still not really able to mobilize those resources. And as someone who had monkeypox and recovered from it, it just is super frustrating to see, because I don't want anyone to have to go through what I went through. And it feels like we could be doing more to help stop this.
I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Unfortunately, health issues that affect the LGBTQ+ community historically have a bad track record in the United States of being taken seriously. And I think that this is another manifestation of that. I don't want to blame it entirely on that, especially because homophobia and things like that have marginally improved. I do think that because it was only affecting a relatively small segment of the population, that it perhaps was not prioritized as early as it should have been.
On Friday, June 17th, I got a call from a friend I'd been hanging out with the weekend prior, telling me that he was pretty sure he had monkeypox and that I'd been exposed. And so after that call, I checked myself. I noticed some lesions I had not noticed before. So it became pretty clear pretty immediately that I likely had monkeypox. You know, the first few days, the first week since I realized I had it, it was mostly flu-like symptoms. So I had, you know, an intense fever, full body chills, sweating through my sheets at night, sore throat, cough. Those lasted about 5 to 7 days. And as those let up, more and more lesions were appearing across my body. We are seeing a lot of parallels of what happened with HIV/AIDS, right? Like a slow government response because it's primarily affecting queer people. That's really unfortunate to see. I do think, unfortunately, there is real potential for stigma. I know when I was speaking out, I was fortunate that most of the comments were well wishes, you know, for a speedy recovery and whatnot. But there were quite a few, you know, internet trolls saying really cruel, unkind things to me. And, you know, I'm afraid that that reflects in the real world too, right? Like if people who perhaps are homophobic or have prejudice or whatever see this, that could be used against the queer community. So to anybody who is exposed or comes down with it, I want to reiterate that there's no place for shame or stigma in it. You know, it's just the way the cards fell. You've done nothing wrong. And what helped me the best was to remember that although it might be awful, it is temporary. You know, I think vaccines are the #1 most important thing that we can have right now to help curb this outbreak. You know, I'm hoping that we get this huge supply that's sitting in a warehouse in Denmark right now into people's arms ASAP, especially in the demographics where it is most needed or spreading. Seeing a lot of people actually posting on Instagram, Twitter, TikTok, etc., who come down with it, and they're posting their lesions and talking about the symptoms. There's, I think, a huge community effort underway right now to share information and resources with each other. You know, we've already talked about the vaccines and the testing, but the treatment, tecovirimat or TPOXX, the antiviral that actually treats monkeypox, is caught up in some red tape limbo right now. And that is really frustrating that people who have severe cases and are suffering in real time are not able to get access to this drug that is already FDA approved, but due to some arbitrary regulations, is really, really difficult to prescribe for providers. So, you know, I'm urging the government, the FDA, the CDC, the White House, whatever powers it be, to clear up that red tape and approve this to treat monkeypox in addition to smallpox so that people who have severe cases do not have to unnecessarily suffer.